Hello ladies and welcome back to my channel. My name is Aisha, aka Nurse Aisha. For those of you that are new here, welcome to our female to female conversations. For the oldies but goodies, welcome back. On this episode of non-communicable diseases, we're going to talk about chronic respiratory diseases in your lungs and airways. We're going to focus mainly on asthma. Now, asthma is usually known as a children's disease. That's not the case anymore. Many adults are getting asthma. Now, you probably know someone with asthma. I know I do. Millions of people have asthma worldwide. It's the most common respiratory disease all over the world. And I'm going to tell you why. So why are people getting asthma? So the number one reason is tobacco smoking. Secondhand smoking. Our children are being exposed to cigarette smoking. Now, the happy news is many countries have banned cigarette smoking indoors in restaurants and clubs. But that's not enough. People are smoking in other environments, at home, in their cars, exposing children to cigarette smoking. Now, others that are not smoking are choosing alternatives. That is not better. Whatever you're inhaling that is not oxygen is damaging your lungs. Now, the second reason is environmental factors. We have pollution, gases, chemicals, our cleaning products at home, our detergents. You have the cleaning lady that is constantly exposing herself to these chemicals. That is damaging our lungs and airways, which exposes us to asthma and other lung diseases. So how do you know if you have asthma? Well, the most common symptom is breathlessness, shortness of breath. You cannot get enough air into your lungs. The other symptom is wheezing. I know you've heard this before. You've heard that person wheezing for air constantly as though they have a cough, which is the third symptom, is the coughing, the constant coughing. And this usually happens when you are exposed to your trigger, which can be pollution, dust, or other fumes. A person with asthma will cough if they get into an environment with cigarette smoking or whatever trigger they might have. Basically, this could be dangerous, life-threatening for that person if they don't get away from the trigger. All right, so if you think you have asthma, you have all the symptoms, you feel breathlessness, you feel really tight in the chest when you get exposed to your triggers, you need to go to your doctor or a nurse to talk about the symptoms and actually get a diagnosis and treatment. So what the doctor needs to know is your triggers, your symptoms, how long they last, and the intensity of your symptoms. Now, this is very important because that determines what kind of treatment you're going to get and also what type of asthma you have, if it's a light type or it's a very severe asthma. The other things that the doctor needs to know are other conditions such as eczema and also allergies that you might have, because it could be just an allergy that you are feeling. So what the doctor does to determine if you have asthma or any other lung disease, they will do different testing with different machines. Now, the first one is a FeNO test. Now, the FeNO test is done to determine signs of inflammation in your lungs and airways. So this is done with a machine that you blow in and out of. Now, the second one is a spirometry. Spirometry is a testing where they test your capacity of your lungs, how much air you can fill your lungs with and how much you can blow it out, the amount of air that you blow out of your lungs. This will determine in what shape your lungs are. Now, the third test is the peak flow test. The peak flow test is done over a period of time to determine what kind of shape your lungs are. If they're getting worse or they're in the same position. This is a peak flow test. Now, if these tests are not enough, they could go ahead with an X-ray of your lungs. Unfortunately, there's no treatment for asthma today. There's only symptom control. So depending on what type of asthma you have or how severe your asthma is, your doctor will choose the treatment. You can still be active, you can exercise even if you have asthma. You can still run a marathon if you have asthma. All you need is your inhaler. So the best treatment today is inhalers. And this depends on how severe your symptoms are. So there's the reliever inhalers. Reliever inhalers is when you want to stop the symptom. So let's say you get exposed to smoke. You pull out your inhaler, you breathe it in, and that is when you stop the symptom. Now then you have the preventer inhalers. This is for people that have severe asthma that need to take it on a daily. So because your airways are very inflamed, you need your inhaler on a daily. These are usually red inhalers with steroids in them. So this basically just opens up your airways. Now, if that's not enough, there's other types of medication. There's the injections and tablets that you can take if your doctor recommends you to. There's also a combination inhaler with both steroids and also reliever medication. These are the best ones today to manage asthma. For most people that have asthma, it's very important to stay away from your triggers. This is what we call preventative health. Make sure that you stop smoking or stay away from people that smoke. This could be not just cigarette smoking or tobacco smoking, but other types of fumes, dust. You might want to stay away from that. Now, if you cannot do this, I know not all of us can stay away from dust. Make sure that you have your inhaler with you, because when your airways get congested, you need this inhaler. You need to stop the symptom. Make sure that you stay away from your triggers as much as possible. Do not use strong perfumes. Do not expose yourself to these triggers, because this could be life-threatening to you. So other things that you can do is exercise and make sure that you have a good diet. Because if you have asthma and on top of that you're overweight, that is not a good combination. That is the best way to deal with your asthma. So I'll tell you why it's crucial for you to always carry your inhaler with you, especially if it's a reliever, but also the preventer inhaler. So I have a friend with asthma, okay? She is an adult and actually got her diagnosis as an adult woman. And this started out with the cough, the constant coughing. Now, unfortunately for her, she cannot walk into a place with triggers. Now, we're in a normal environment for women. We're shopping. Get into this shop with nice perfumes, the lady perfumes. So we're enjoying this trip out. But then someone sprays the perfumes and she starts coughing, hysterically coughing. This is not a normal cough. She doesn't have a cold. She just has been exposed to a strong perfume that is narrowing her airways and she cannot get air. So she needs to pull out her reliever to be able to get air into her lungs. Now, if she cannot do that, she needs help to pull that out. And if she doesn't have it, we need to call for an ambulance for assistance to breathe. Most of us might not even have access to ambulances that will come and help someone get away. So it's very important that you know your triggers, stay away from them, and if you do have your reliever, make sure that you always put it in your bag. We have to tell the difference between being overly sensitive and actually having onset asthma. So I used to smoke, that's no secret. Fortunately for me, I do not have asthma, but I'm very sensitive to products, chemicals that we use to clean the house, and strong perfumes, especially male perfumes. Now, the difference between me and my friend is that she has a diagnosis. She has asthma and she needs medication to deal with this, especially when she comes in direction of her trigger. So aside from asthma, there's other chronic respiratory diseases, one of them being chronic obstructive pulmonary disease, which includes emphysema. Emphysema is a serious lung disease where your lung sacs have basically been damaged. Another one of them is the chronic bronchitis. Chronic bronchitis is a long-term inflammation in your airways. Now, other chronic respiratory diseases such as occupational lung disease, as well as pulmonary hypertension. Now, these diseases usually affect people that smoke, except for the chronic cough, the smoker's cough. I know you know what I'm talking about. You're also thinking, all right, so my uncle has smoked for years and he doesn't have this. Well, he has probably other diseases. Diabetes is one of diseases that you can get because you've been smoking for many years. So other types of diseases can affect smokers, except for the diseases in the lungs. This has not completely been proven, but there's studies connecting smoking to pancreatic cancer. So smoking is damaging our lungs and our airways, giving us all these diseases, all these chronic respiratory diseases. So, ladies, are you smoking around your children? Are you exposing your children to diseases in their airways? Now, besides from that, we have, unfortunately, climate change. Climate change is one of the reasons why we're getting more and more diseases in our lungs. We're being exposed to pollution, and this is irreversible. It's unfortunately irreversible. Now, I'm just a nurse. I'm not going to solve this problem. But let's work together to prevent chronic respiratory diseases. We need to think about what we're exposing our children to. Are you smoking around your children? What are you using to clean the house? What kind of products? What type of detergent are you using to wash your children's clothing? And also, what type of insecticides are you using? I know in many countries, before we go to sleep, we spray the whole room to kill those mosquitoes, which is important to prevent other diseases such as malaria. But this type of fumes we are inhaling during the night, is it necessary? We have other products that we plug into the electricity and we inhale all throughout the night. It's very important that we don't expose ourselves and our children to these types of chemicals, because it triggers respiratory diseases. Think about this the next time you choose products that you're using around the house. Until next time, ladies, thank you for watching.